It is Carmen. Carmen. Ah. Ali tawala rizal. Tawala rizal. See, he cannot do it without holding his legs.
Understood.
Okay, Alantukum. Again, he has to hold his legs.
So for sitting for namaz and all, he has to do like this.
No, he doesn't sit on.
He doesn't sit.
He sits on the chair.
Understood. Ask him if there is any pain in his hip, knee or ankle area.
في موجود ألم هنا أنت؟ أي مكان؟
مكان أسفل.
He's having pain in the backside. بالظهر. قريب. Yes, near to hip line. He's having pain when he wakes up, gets up.
And stands up.
Yes.
Okay, understood. Understood. And is that pain increasing year after year?
هل كل سنة يجيب الألم يزيد ولا يخفف؟ Increases.
Okay, fine. And can you ask him to show me his spine?
Yeah, he'll lie here.
Yeah,
No
right.
problem. خلي كده ركب يده.
Okay, so he has stayed here. That's what I wanted to see. Okay, fine, no problem. Good. In Bangalore?
They will stay. They will stay because his mother's treatment also is there, and they will stay more 6 months or maybe later than 6 months because right now if the treatment whatever you can prefer, if it gives benefit for him, then
Yes.
he will stay much longer. Actually.
Understood. So see, there are a few things with him. Okay. One is definitely the muscle biopsy and gene level analysis. The whole genome analysis what they've done has shown that there are certain specific protein kind of variations or abnormalities. Okay. That's why the muscle strength is getting lost. Okay. Now muscle doesn't work in isolation. Okay. Nerve, muscle, bone, joint, ligament and tendon, they all work as one team.
Yes.
Okay. So for him to sit and stand up also, the nerve has to send the signal from the brain down to the muscle has to contract or relax.
Yeah.
Then only the joint will bend or straighten up. And bone will help, he'll stand and sit. So if any of these things are weak, that signal and that current will not flow correctly. Okay.
So right now the issue with him is LGMD.
So
limb-girdle
muscular dystrophy.
Muscular
dystrophy. So the muscle itself, the protein that is forming the muscle, that is abnormal. And that is becoming weak. Okay. So what we have to do is we have to think about all the things that will stop the muscle from becoming very weak. At least now he is in a position where he can, at least with the help of his hand, he can control his body posture, sit down and make himself stand. But let's say that muscle becomes so weak and so tight that his knee ends up having a contracture, ankle ends up having a contracture, hip muscle having a contracture, because the knee will become tight like this. You can't straighten the knee.
So it is dangerous for him.
If it is progressive. Now it is very hard for us to predict it. That's why I was asking how he was 1 year before, 2 years before, and that will tell me how he can be 1 year and 2 years in the future. Okay. So past will tell us a lot about the future. So if you tell me no, he was very fine till 3 months ago, and only in the last 3 months everything has happened, then I know that it is progressing very rapidly.
Since I have been seeing him, he is like this exactly.
Okay.
So what could be the possible treatment?
See, for us to do any kind of treatment for him, I would suggest that there are a couple of more things that I need to look at.
Sure.
One would be if he has not had any MRI of his spine, we need to look at for the MRI of the spine. Why I am saying this is certain conditions with muscular dystrophy also, you can expect some abnormality in the spinal cord. If that is there, then when we are giving the stem cells as an IV injection, We also have the option of giving stem cells in the spinal cord also as an intrathecal injection.
Injection.
Into the intrathecal.
So possibly how many injections may require?
So minimum, I would say for him, we need to do at least 3 sessions.
3 sessions.
Minimum is 3 sessions.
So what will be the period?
So if he's, let's say, with us for about a month, then what happens is we can do, let's say, the first sitting, and then somewhere around day 15, and then maybe around day 28 or day 30. So 3 is the bare minimum, I would say.
Will there be any progress with the injections?
Yes, you will start to see at least some kind of muscle responsiveness. What happens now? See, now you want to do this movement. Your brain is telling the muscle to move, but instead of moving slowly, faster, it'll move very, very, very slowly. So muscle responsiveness is what we start to see early. Okay.
I have one query. Because since he is a patient of heart as well, he is having some issue with the heart.
Correct.
Or something.
Correct.
So maybe there in future, maybe in another 1 month or something, they will plan for operation of heart.
Correct.
Would that be possible for him, like do the heart operation with this injection also is fine?
Yes, definitely. In fact, it will help. In fact, it will help. So when they are giving the IV injection,
yes,
the stem cells will go through the heart circulation also. So he has a condition called as VSD, ventricular septal defect. Okay. So they are planning to do the closure for that, as you said.
Yes,
okay.
Yes,
so his overall body metabolism will be better.
Okay. سمعت هو عارف يشتغل دكتور حتى إذا فعل العملية حق القلب في سهل عشان المرض. الآن المرض اسمه LGMD معاد نبيل صح. هو في لازم إذا فعل العملية وبعد العملية حق القلب وحتى يفعل الإبرة كل شيء فيجي صحتك كويس. والآن هم يتكلم في إبرة حق خاصة حق الوريد عشان تجي قوة وكل شيء عشان الجسم حق المعاد.
Okay. So for heart, what we can do is we can make it like a additional 1 session we can give him, including certain exosomes if we give. That will add to his heart recovery much faster.
Okay. How many months may he require for getting much better treatment?
See, minimum if you are looking at any kind of structural changes, that means his muscle strength has to increase, where he has to get a little bit of confidence. No, you are looking at somewhere between 4 to 6 months.
4 to 6 months. Since we have been also to Nimhans, we have gone there, and we have been also referred. Then we can do the physiotherapy as well. I think you have physiotherapy.
We have physiotherapy upstairs on the floor.
We are looking for him to do 2 times a week actually. Would that be fine?
Yes,
like because fine. He cannot come from very far away.
Where is he staying now?
He is currently staying near to Fraser Town.
Fraser Town. Okay. So what we can do is, see, I can tell you, I can write and give the regimen for the exercises to be done. If there is a physiotherapy closer to where he is staying, or physiotherapy coming home and doing, or some center close to where he is staying, you can take him there, he can do physiotherapy there also.
Okay, but his brother, what he wants is, it's better for him to come here in front of the supervision of the special doctor because he wants his treatment to get as soon as
possible. Definitely, yes, that's Dr. Sriranga was waiting outside our physiotherapist.
We can have a look.
Yes, it's on the 4th floor. You can go. I'll ask him to show him the center.
Sure.
He can look at that.
Yes,